Thank you for joining us for today's CITI program webinar. Today's topic is Informed Consent and Clinical Investigations, a focus on the process, and it is presented by Linda Reuter. This webinar will be recorded, and the recording will be available on the CITI program's website. As a quick note, this webinar is for educational purposes only. It is not designed to provide legal advice or legal guidance. You should consult with your organization's attorneys if you have questions or concerns about the relevant laws and regulations discussed in this webinar. The views expressed in the webinar are solely those of the presenter. Now, let me tell you about today's presenter, Linda Reuter. Ms. Reuter began her career in IRB administration at Northwell Health, New York's largest healthcare provider, serving New York City, Long Island, and Westchester. She has held various positions within the health system's HRPP over a 20-year period. Linda formed IRB Consulting, LLC in 2012, providing IRB administrative services, training, and education, audit services, and general consulting to numerous IRB programs, including Brainy and HRP Consulting Group, as well as several local institutions. She currently serves as the director of the Brainy IRB.
So let's review the 3 learning objectives for today. First, we hope that by the end of the webinar, you'll be able to identify and understand some current challenges related to the effectiveness and validity of informed consent. We also hope we will also be going over some potential strategies that can be used to help improve this overall process. And we also hope that by the end of the day, you're equipped with some potential next steps toward improving the consent process in your own local institutions. So what this webinar will not be is a review of the basics of informed consent. So I kind of expect that I'm speaking to a somewhat seasoned group with everyone has a basic understanding of informed consent and all the relevant ethical and regulatory requirements. What I hope to do today is take a deeper dive into our experience with taking this fundamental knowledge that I assume we all have and the guidance that we have available to us and turning it into something a little bit more meaningful. So we'll discuss how the current process is or is not working. We'll discuss methods that might be used to improve the way research information is conveyed to potential subjects. And we're also going to discuss the IRB's role in all of this. Let's start by looking at some key challenges that have already been identified. So the literature supports the fact that there are many challenges related to consent. Let's go back for a moment and think about the origins of informed consent and a few of the historical events that got us to where we are today. So one example would be the Nazi experimentation, where consent was not a thought, which in today's terms would be, of course, a violation of the principle of respect for persons, and which led us to having rules and ethical guidelines for making sure we don't experiment on humans without their consent. Another example from history is the Tuskegee syphilis study, where research was performed without informing subjects, or where individuals were led to believe there was some sort of therapeutic benefit to participation, which often led to very unethical research scenarios where people were not only misinformed, but they also in many cases suffered significant harm or even death. I think we'd all agree that requiring informed consent from potential research participants is an ethical and necessary step in research. But I think this desire to convey certain information to subjects has evolved into a very complex document that includes, in many cases, exhaustive information. I've seen consents as long as 50 pages in some cases, or even more, I've heard. So basically what we have is a switch back to relying on the researcher or the person getting consent to communicate the information to the subject, since the consent document is very often overwhelming and difficult to digest for many research subjects. And the most important information may be getting lost. So the process becomes the key to obtaining meaningful consent from subjects. Okay, so let's dig a little deeper into potential strategies and try to get practical with it a little bit more. So reliance on a document, getting a signature on a form, of course, these things are much easier to implement. Moving to a focus on the process is more complex, obviously, and there are really no standards right now on how to effectively do this. I think everybody would agree that a focus on the process makes sense. And we've already seen from our poll that people feel like tailoring the process to the individual is appropriate. We've talked about several principles related to strategy. So let's talk more specifically now on how we can actually do this, and also on what work remains, that needs to be done to go forward. As noted by this author, our focus should rest on the process. So what are some steps that we can take now? Here are some areas we can focus on as we move forward. So when we talked about health literacy, we discussed the need for research information to be clear and easy to understand. We also noted that this clear communication is not a one-time event, but must be ongoing throughout the subject's participation in the research. The CTTI project in 2016 in this area of informed consent noted among their recommendations that additional training for research staff was integral to improving the informed consent process. So we see there that a well-trained staff is key. In summary, so I think what we've learned today is that there are several challenges when it comes to informed consent, that a focus on the document has not worked to date, and we definitely need some sort of change going forward, that our goal should be to communicate with subjects and convey information to them in a way that they individually will best understand, that we went over some potential strategies for improving the process and the fact that we definitely need to explore these things further. We've seen that IRBs can play a key role in trying to change the landscape, that standards and resources are definitely needed if we're to go forward with these ideas, and that maybe development of a training process or some sort of licensure or certification should be considered as we move forward.
Linda, thank you again for today's presentation. We'd also like to thank our audience members for joining us today and for their questions. We encourage you to monitor the CITI program website for additional information about future webinars, available on-demand recordings of past webinars, and our new all-access webinar package. You may also be interested in the CITI program's additional modules of interest in the Human Subjects Research courses, which focus on advanced issues in informed consent, including specific topic-focused modules on remuneration, therapeutic misconception, consent with subjects who do not speak English, cultural competence in consent, and others. Please visit the CITI program's website to learn more about all of our courses and webinars. And that concludes our webinar. Have a great day.